everyone's doing okay tonight. This video, hopefully, is going to be relatively straightforward and quick. I want to discuss healthcare in this country. I want to discuss this for obvious reasons. I just got back with my wife from testing that she had done today in order to figure out what's going on with her tummy. I am going to take the position that healthcare is a human right. Now, I know that's somewhat subjective in taking that particular position because it all depends on what you consider to be a standard, meaning what is the thing to which you are making this consideration on. Otherwise, it's just what you think. But I would make the case that if your goal, if the target, if the thing that you're trying to accomplish from the standpoint of a society is cohesiveness, safety, security, health, and any level of happiness, healthcare, particularly in societies that have evolved to the point where they are technologically and I want to say economically, but I'm using economics just in the means of whatever system they've come up with. They have enough, let's say, things. Yeah, I would argue that at a certain level, if the goal is health, happiness, and I would even argue from the standpoint of morality or ethics, healthcare should be a human right. I don't have to say this, but I am going to say it. We have a deeply broken healthcare system in the United States. We pay twice as much as everywhere else in the rest of the world. And this is not because we use healthcare more than the rest of the world. You're talking about drug costs, physician costs. Everybody's trying to maximize their profits at the expense of the individual. And mind you, oftentimes the person or in the condition that they're trying to maximize their profits on is in some of the worst scenarios that a person will be in the course of their life. This person is cancer, this person is an injury, this person is some kind of disease. And you have all of these structures within the medical industry taking a chunk out of you could say the injured person's hide. In the context of this, healthcare costs continues to spike. This is even with Obamacare. And I say this because I kind of want to make the point that real wages haven't gone anywhere in the context of healthcare wages spiking. Take a look at this. I was watching, while I was waiting for her test was like 4 hours. They had TV on. So this just so happened was perfect. So manufacturing jobs in the United States. Look at this chart. Clinton, Bush, crash. This is 2010. This is where it is now. Under Trump. Under Trump, it pretty much didn't go anywhere, and the trend was happening from Obama. But look at where it is compared to where it was. Regardless of the reason for that, where did those people go? Those people didn't just evaporate. Those people still needed to find ways to ensure that they ate, their house was okay, their family was okay. They needed still to make ends meet. Take a look at this one. Economic output, if I can find it. Come on. There we are. Manufacturing output. The first one were manufacturing jobs, good paying jobs where people were making decent wages. But look at output. Output hasn't gone anywhere. Output remained relatively constant. Meaning, even though you had that dramatic drop in the number of people who were in the country, the output itself stayed relatively constant. You were able to make all of the things that you needed with less human beings. Those people more likely than not went to the service industry where they're making less wages. Do you believe that just because those people lost those good paying jobs that they need less health care? Do you believe that their access, meaning this is going to be determined that they're somehow going to avoid illness because they no longer have the capacity to deal with a medical situation if it came up? And by the way, even in this scenario, meaning even when they did have that decent job, I guarantee you what they're making after some kind of major illness lessens. This is just by statistics. It goes down. But that's assuming they're able to work even after that illness. Meaning people, even with these decent jobs, there's no telling whether or not they could deal with the medical realities of today. Add into context, the majority of the country don't even have $500 in the bank. I say this for obvious reasons. If you have a healthcare system that is for profit, meaning they get to maximize their profit of your illnesses, while simultaneously the wages in the country for the most part have remained flat and hasn't gone anywhere, while the healthcare industry continues to spike in regards to costs. Healthcare was the number one issue that was talked about. Immigration was number two, but healthcare was number one. This is something that's affecting the overwhelming majority of the country because all of us, ultimately, in this very specific issue, are intimately vulnerable. One of the things that I watched today was a woman who had a lien on her house because she couldn't afford to pay a bill. The bill just kind of sprung up. I know cases of dialysis patients where they just stop paying medical bills. They don't have any assets, and because when you're in a facility, most people who are on treatments don't work. And just in talking to them, most of them are in a certain economic reality of poverty just based on the condition to which they found themselves, but also to the bills because Medicare only pays 80%. There's this other case of people on diabetes, again, testimonials, where they would skip medication because they can't necessarily afford it, meaning they ration it themselves because they can't necessarily afford the medication. This is not the society to which we should be enduring. And this is not necessarily something that we have to endure. This is not an act of God. This is an act of policy. I want to talk about this in two ways. And I'll end it on those two ways with a very particular point about Medicare for all. And that seeing that all of us are intimately vulnerable in this way, this should be somewhat of a collective will. And Medicare for all should be a litmus test. I'm going to talk about it from my wife's issue for today and from my own issue from back then. My wife gave me permission, and I don't think my mom is going to care me talking about our case. Starting with my own case, because I want to give a perspective of something that was a little bit more serious, and I want to give a perspective of something that wasn't as serious to show you that in both cases, both people were entirely vulnerable. Even in both cases where one person was not necessarily economically well off, the other person was at least stable. But in both cases, it greatly adversely impacts that person's ability to function. In my mom's case, when I was 17 years old, I was diagnosed with kidney failure. And apparently this went back to all the times when I was 12. But the wild part about this is when my mom had to deal with doctors, of course you have to deal with your main doctor. You have to deal with the new doctor that comes on. You have to deal with the testing. You have to deal with any kind of surgery that takes place. You have to deal with the subsequent treatments. And this is to somebody who was poor by any means, by any real standards of gauge. This was somebody who didn't even have the means to make ends meet under normal circumstances, and now has a kid that's ill, has health care, so has health insurance. But the health insurance doesn't necessarily matter if you're being hit with deductibles or you're being hit with the money that you need to pay just like copays. It's fucking economically damaging. I would wager to you that most people would be vulnerable to that. Again, if the majority of the people don't have $500 in the bank, anything that comes up like that is going to be devastating. She was able to eventually get help from Medicare, but that went on for months before she was able to get help from healthcare, governmental assistance. In my wife's case, she has healthcare. In fact, both of us have the exact same healthcare policy. Since when I started doing this, I essentially pay her and we both have healthcare. So she gets a family plan. So the family plan in and of itself is expensive, meaning we pay an obscene amount of money for her healthcare plan. But then when you get to use it, you find that it's dramatically inadequate. And this is not a horrible plan. It's just the plan is, first, she finds out that she has a deductible of, $2,500. Meaning before anything gets done, before the insurance company really gets involved, $2,500. She also has copays that are obscene and drug costs. They told her that the only way she'll be able to get her drugs is from Walgreens because they don't necessarily want to pay how much it costs in some of the other pharmacies. This is healthcare companies telling people where they should actually buy their healthcare, their medication from. You can imagine that this was not necessarily a good experience. Her very first test We don't know what it is. All right. So she has to go to a primary care doctor. Then after not knowing what it is, if the first few tests don't show what it is, at that point you're going to have to get additional tests. All of this costs money, and all of this costs money with additional doctors depending on the doctor. And God forbid you end up in a situation where you're in a hospital and you have to talk to various doctors. The hospital itself has a cost. The doctor has a particular cost associated with it. If you have additional doctors who are coming in, they will have their own costs associated with it. Some of them may take your insurance. Some of them may not take your insurance, meaning some of these costs will be directly out of pocket. Some will be covered by the insurance. This is a horrible system. This is a horrid system. In my wife's case, thousands of dollars. Thousands of dollars. And this is over the course of maybe a month or two, seeing various doctors being ping-ponged around. My mom, my grandmother, my wife, all of them have some kind of medical thing going on. I, of course, just from going back from thing, but theirs are more active and theirs are the things that are more prevalent. And you ask, how is a regular person in a society, and that regular person who, let's say the average person, is only making around $30,000 a year, that average person doesn't have $500 in the bank, that average person at some point in their life is going to be hit with some kind of medical illness, meaning all of us are vulnerable. Why do we allow this? Does capitalism need to affect each and every aspect of our society? And can't we, as a collective, come to a conclusion of saying, yeah, this needs to stop, and not have ideologically based decision-making processes? Meaning, I know that this is a Hotel California. Within regards to ideology, everybody has a particular point of view. But that point of view can't be compared against the natural world to figure out whether or not there's legitimacy to it or not. Meaning, Obamacare's, this neoliberal utopianism of Obamacare, where parasitical insurance companies are still allowed to make their profits, as opposed to human beings being the point. He needed healthcare industry to be a part of the process and protected the drug companies that allowed those people to screw over and continue to screw over his voters. Trump went with a more cynically sinister plan of Trump Care that's assuming that he couldn't get them to destroy Obamacare outright. Both were done purely through ideological means, neither of which had the individual as being the primary point of the reform to the healthcare plan. My point here is we can look out at the rest of the world. We can do analysis. We can do studies. We can put a bunch of experts in a room and we can ask them, scientists. I'm talking about a scientific model of governance to some degree, particularly on issues like this, where the question is straightforward. How do you cover everyone in this country while simultaneously cutting costs? And what is the best healthcare plan to do that? Particularly if the individual, the human being, is the primary point of what you're trying to accomplish. I put to you that that answer would be Medicare for all. Don't take my word for it, take Clinton's word for it. One of the things that came up in the WikiLeaks statements were her saying, yeah, Medicare for all would be the best plan. Mind you, she was simultaneously saying to Bernie Sanders that Medicare for all was pie in the sky. I'm saying we should be militant about this idea of reforming healthcare. This is something that's going to affect each and every one of us at some point. We're all, or at the very least the overwhelming majority of us, are vulnerable to this. A small bump in our taxes, a progressive tax on this, where the top 1% starts to pay their fair share and assist with some of the people who buy their products and work at their companies and allow them the pleasure of being a millionaire or billionaire in American society. Happy that you're rich. It's time to pay a fair share. Each and every person in this country should have access, should have health care. And yeah, I go so far as to say it should be universal and it should be a human right. Medicare for all is a plan that gets you there. Simplest, straightforward, expansion of Medicare to include each and every person in this country. They bitched about Obamacare being 3,000 pages. There you are. My point is we should be militant about it. It should be in the same way that America decides to protect Estonia. Meaning if anything happens, where Russia takes Estonia, the United States and the Western powers will automatically kick in gear almost like a machine. It's automatic. There is no thought into the process. It's a treaty. You do this because you want to be very clear that if X happens, Y would automatically come in as if we have no agency in the process. I think we should be the same thing about our support and insistence that Medicare for all be a litmus test. Our healthcare system is not broken as an act of God. It is broken because people make a ton of money with it being broken. I put to you that that needs to change. Capitalism doesn't need to affect each and every area of our society. And I would put to you again that this is one of those areas, do you really want people making tons of profit off of other people's illnesses and failings? It's gross and immoral, ethical, evolving society. Yeah, I would argue that healthcare is a human right, especially if health, happiness, security are paramounts in the things that your society aspire to achieve. So I'll end this here because, like I said, I didn't want this one to be long, and 14 minutes is not horrible. I have a few shows for tonight, so I'll be back on. In fact, I have like 3 or 4 shows. Some of those are going to be relatively short, but some are going to be more involving. Trudy asked for 420. I want to oblige her on that. I don't know if that's going to be tonight or tomorrow, but one is coming up in the works. And for my patrons, I am probably going to introduce to you the channel that I am coming up with as a sneak preview that you guys would get access to. And I may even give one of the first few shows. So I'll see you guys in a few. Thanks all.